If you are a woman who have had a hysterectomy and you want to know the best tips to help heal yourself after a hysterectomy, or maybe what to expect if you are going to undergo that surgery in the near future, then you want to watch this video. My name is Dr. Dawn Andalone. I'm a pelvic floor physical therapist and co-owner of Level 4 PT and Pilates, and we help women who want to heal their body in a more holistic approach and really have long-term relief from their symptoms without medications, and if you've had a surgery, how you can recover the best way. So keep watching if you have had a hysterectomy or you're going to have one and you want to learn 4 tips to help your body feel its best afterward. So with a hysterectomy, there is a couple different types. There's a partial and a total hysterectomy. So whether or not they removed your ovaries or just your uterus, there's different types of the surgery, but some women may have an incision on the abdominal area, and some women may have more of a laparoscopic surgery, or they went through the vaginal area to remove the organs. So with having the recovery afterward, it's really important to be supported and guided by a professional outside of your surgeon or gynecologist, and someone that can support you, like myself, a pelvic floor physical therapist that can guide you on activity level, how to really heal your body, what to do about scar tissue or any uncomfortable, painful symptoms that you're having too. There isn't a lot of guidance out there for after a hysterectomy when it comes to the physical side of healing, and many women are just told their restrictions. They shouldn't lift anything heavy, they should rest in the beginning, they should not go up and down stairs or do anything too strenuous right off the bat. So all those are great for following what the doctor is telling you to prevent any complications from happening and allowing your body to heal. But what happens after that? You really want to move in the right direction of getting back to the activities that you love to do and optimize your body for healing. So the number one thing that we love to guide women on is what happens if you are having some pain. And the doctor may tell you that it'll take 6 weeks to recover, but we've seen women that will take a lot longer than that, and that's okay too. Everybody is going to be a little bit different. So making sure that you're really getting that rest and restoring your body after a surgery like that is going to be really important in the first 6 to 8 weeks. But if you're putting yourself on a timeline and you have to go back to work or you have to go back to an activity, then you may realize that it may take you a little bit longer. So if you are feeling any extra uncomfortable feeling down in the vaginal area or maybe the lower abdominal area, and you're not sure if that's normal, then it's great to see a pelvic floor therapist to be guided in the right direction and allow your healing to be more optimal too. So we teach women how to start with just some basic breathing exercises. Breathing exercises are underrated, but they can be really helpful for healing that whole area with your core and your pelvic floor muscles, because here's your pelvis, your core muscles, your deep abdominals lie right in front of here. And many times if you've had an incision there or even portal sites from a surgery like that, then we want to work on some scar tissue massage and making the muscles around the abdominals really activate in the most optimal way again. So feeling that extra painful, uncomfortable, maybe bloating or uncomfortable feeling in that lower abdominal area, scar tissue massage and taught by a professional can be very helpful too. So that's one thing that we teach you, along with some breathing exercises to help this area heal and get more blood flow and circulation to the area. The next step would be women may experience more bladder urgency or more difficulty controlling their bladder function afterward. And that's where we want to work on the pelvic floor muscles and make sure that they're able to function properly. I'm not talking about going back and just doing Kegel exercises. That may be part of it, but it's not always a strength issue. If there's any kind of surgery with trauma down in this area, many times those muscles respond to creating more tension or tightening up in a way that's creating more uncomfortable feeling or pain. And women sometimes will complain when they go back to having sexual intercourse again that it's very uncomfortable. So that tells us that those muscles can hold extra tension, or they can, that's a response after trauma to the area like a surgery. So we will be able to work on some yoga poses, some stretching, some breathing, some hip stretching exercises, things that are going to help that area restore itself and allow the muscles to relax a little bit, because they're undergoing a lot of stress and tension, which therefore is creating more pressure on your bladder. So that is another thing that many women don't realize after a hysterectomy. You may have changes in your bowel or bladder function. So your bladder and your bowels are all controlled by, as well, those pelvic floor muscles. So we make sure those are functioning optimally too, with relaxation and contraction. Then if you are going back to an activity where you're having to lift anything heavy, we want to make sure that your muscles are supporting you around your pelvis. Once again, if you've had trauma to that area, your muscles respond with sometimes shutting down or shutting off, or they respond by tensing up and creating more pressure there. So we want to make sure your muscles along your spine, your muscles along your hips, like your glute muscles, the big powerhouse muscles, and your deep abdominal muscles, not the six-pack ones of doing crunches, but more the deeper layer of your abdominals, how those muscles can all support your pelvis even better and support your bladder and your rectal area and help those that area really heal itself after a hysterectomy. So we may use Pilates-based exercises. It's going to focus on breathing, control, and strength of your core. I'm not talking about going back and doing crunches and planks all the time. That may be part of your routine, but something that's going to connect your brain with your core and get those muscles functioning again, because they have to learn how to work again. And this is very common after any kind of abdominal surgery, after a C-section, after a hysterectomy. We have to train them. It's called neuromuscular training, and it can make you feel like you're connected to your core again, which is a common complaint after a hysterectomy or a C-section, that you feel like you're not really connecting to those core muscles. So we like to train them again and get more support around the abdominals, the back, and your hips too. Then also after a hysterectomy, so we have scar tissue mobility, we have breathing, we have proper rest and hydration, nutrition. Those things are going to allow healing to take place, making sure you have enough water and protein in your diet. So those are going to help your body restore and recover even better. And then the proper strengthening exercises too. So there's a lot more that can be done after hysterectomy if you're supported and guided in the right direction by a professional that is used to working with women after a hysterectomy. And many times women are just sent on their way to say what not to do, but how do you actually know how to optimize your body after a hysterectomy? So that's where we'll focus on too, and getting your bowel and bladder function back to where it should be, making your sex life more enjoyable, because that's important too, and really feeling like you're strong and you're in your body again, and empowering you to feel better as well. So we work with women after a hysterectomy all the time. It's one of our specialties. And if you have questions about this or comments, or maybe you're concerned about an upcoming surgery, or you had one and you have more questions, then I would invite you to leave those questions or comments down below in the comments section, and we love to answer those as well. So the next video up is going to talk about core exercises, basic ones that you can start doing maybe about 6 to 8 weeks after having an abdominal surgery, how you can connect your brain back to your core. It's a core foundations video, and working on some breathing exercises to be able to help it too. So watch that next video. And if you liked what you hear and you want to learn more from us about women's health topics that we love to help women and guide them in the right direction, then I would invite you to hit that subscribe button, and we will give you more content that you want to hear in the future. Thanks for watching.